Hi, beautiful people. It's Wonderful Wednesday. I'm April Roll, your ER doctor online, and today this video is going to be talking about the COVID-19 vaccine. So if you have any questions about it, this is the video for you. I'm also going to be talking about my experience with the vaccine in this video and pretty much just giving you an update on how things have been going since I got the vaccine. This video is going to contain some scientific information and sciencey speak, but for the most part, the overall message is just to let you know what exactly is the COVID-19 vaccine and how does it work. So currently, today, as of December 23rd, 2020, in the United States, we now have two different vaccines that are authorized. We have the Pfizer COVID-19 vaccine and we have Moderna's COVID-19 vaccine. So again, going back to what is it and how does it work? I'm going to use the analogy of a recipe to make a cake. So in this video, I am going to be using, bear with me, I am going to be using this wonderful cake that we have here, okay, with this beautiful red frosting. So the way that it works, pretty much, with the vaccine, mRNA stands for messenger RNA. All of us have messenger RNA in our bodies, and just as the name suggests, it is a message and it allows the ribosomes in our body to get instructions from this message and synthesize proteins that we need in the body. So enough with the sciencey talk. Let's bring it back to this cake analogy that I spoke about. So here we have a recipe for some cake frosting, okay, some red cake frosting. And this is mRNA, and these are the instructions in the recipe, okay? So this is the mRNA. In the vaccine is using mRNA, okay? So it is solely an instruction or a recipe, okay? It is not the coronavirus, it's not COVID-19, it is simply a recipe or a list of instructions, okay? So once that mRNA vaccine is injected, as I said, these are instructions, then next we have our cute little person or ribosome, okay? We have our ribosome who is going to read the instructions, right? The ribosome is gonna go on and read the instructions. After the ribosome does that, it is going to make the red frosting that is going onto the cake that we talked about earlier. Now, in this analogy, the red frosting is the spike protein on coronavirus. So just to break it down a little bit for you, the spike protein that is on coronavirus, let me just lift it up here for you. Let's say that this is the cake with no frosting, but this is just for me to let you know. COVID-19, the virus, the disease that is caused by the SARS coronavirus 2, it has these spikes all over. These spike proteins that sit on the surface. And that's exactly the analogy that I'm using here. This is the spike protein, the red frosting. So just to give you a complete summary, the vaccine was an mRNA vaccine, right? A recipe for a list of instructions for our body's ribosomes to make the red frosting. Because in the vaccine, the red frosting is the set of instructions that the mRNA was giving. It was giving instructions to make the spike protein or red frosting that is going to go on. It's not going on a cake, which is the coronavirus vaccine. It's simply the red frosting. When that gets into our body, the immune system recognizes that this spike protein, i.e. the red frosting, this does not belong in our body, okay? This does not belong in our body, okay? So what it does, our immune system has special cells that goes around and they say, look, this doesn't belong here. Let's get rid of it, okay? You know, the T cells, the B cells, every part of our immune system, the macrophages, they go into the mode of, okay, we need to, if we see this ever again, we need to get in gear and we need to go into attack mode. So that is the point of the vaccine. The vaccine has, again, introduced not the virus. It has only introduced instructions that will encode for a protein that will get taken away by the immune system of our body. That's solely what it's doing, is building an immune response so that if ever we come in contact to the SARS coronavirus 2 actual virus, again, T cells, B cells, macrophages, all of our fight cells will go into attack mode and will attack. If, like I said, we come in contact with coronavirus, it will attack it. That is the whole idea of the vaccine. So again, if you guys have any questions surrounding the vaccine, coronavirus, COVID-19 disease, please list your questions below. I hope that, you know, with the cake analogy and the frosting analogy, I was able to kind of show you that the actual Pfizer vaccine and the Moderna vaccine, it's solely a vaccine for instructions to make something for your body to recognize. If we ever see this again, we're gonna deal with it. That's simply it. Now, to go on to my actual experience, I got my vaccine, the Pfizer vaccine, on December 18, 2020. And I am happy to say that I have not really experienced any side effects or anything like that. I'm lucky enough, knock on wood, that I don't have any known drug allergies, and I didn't experience any type of allergic reactions. I didn't have any local reactions. A lot of people have been getting local swelling, which is very common in any vaccine, or, you know, some mild kind of general aches like body aches, or some mild, very mild flu-like symptoms. Again, this is day 5 for me, and I have not, thankfully, I have not experienced any side effects from the vaccine. I know, you know, this is still early, and, you know, people are saying we don't really know of any late phase side effects because it just hasn't been that long. But you know what, in terms of the efficacy of the vaccine, and in terms of, for me, risk versus benefit of, you know, taking the vaccine versus potentially getting COVID-19, you know, I wholly believe the science, and I wholly believe in, you know, doing my part in order to help us get through this vaccine. But again, my part as a physician is to be an educator, and it is to be an advocate for you all. So if you have any questions, any concerns, any fears, feel free to leave your questions in the comment section below. If you don't want to leave your questions in the comment section below because you don't want nobody to know your business, or you don't want anyone to look at you in a certain way for seeking out medical information, just send me, you know, a direct message. That's completely fine. But I hope that this video has given you some information, helped you make a better informed decision. If it has helped you, please share. Again, if you want to leave comments in the section below for questions or anything, or if you prefer to give me a direct message, that is completely fine. But Thank you for spending this wonderful Wednesday with me. Be blessed and stay healthy.